There seems to be some confusion about the two-hospital plan the towns of Bracebridge and Huntsville are saying is the best option for the future of local health care. In a joint special meeting in the beginning of February, the councils approved a plan that would see the hospitals in both locations stay open. However, Muskoka Algonquin Healthcare CEO Natalie Bubella says it seemed to be building on a hybrid model plan MAHC introduced last year.
And I guess what surprised me a bit was that particular model, despite them stating that it was the second most popular choice, actually was the least popular when we went out and polled the communities around it. And in fact also engendered the community rallies that we experienced last year. They were specifically around that particular model, as well as the petitions that came out. Over 6,000 people signed petitions specifically against this specialization or differentiation type of model that they're proposing. So I guess what surprises me a bit is to really understand more about why they did settle on that model, how they were mitigating some of the risks that we identified in the model last year, and how they're going to buy community awareness and agreement to move ahead with this.
So is this plan similar to the MAHC hybrid plan? Bracebridge Mayor Graydon Smith says yes, in a lot of ways.
It's really about a Site A, Site B scenario where different services will be offered at differing sites. However, it does protect some vital aspects of healthcare in each community, which is emergency services, inpatient beds, the ability to get care right away when you're having an issue. The other thing that we talked about a lot at the joint meeting was, if you check in your home hospital, wherever Site A and Site B would be, and you need to have surgery in the other hospital, are you going to get to convalesce and recover at home? And the answer is absolutely yes. So those are, one of the things, or that's one of the things we wanted to make abundantly clear.
Although the hybrid model was unpopular last year, Smith says not only is this new plan a better fit for the community, he says a lot has changed since then.
We've got a decision from MAHC on what they want to do, and I think universally it's been not accepted by municipalities in Muskoka as something we can get behind and is good for growth. But part of what has changed between then and now is the communities that have been involved in this have done a far deeper dive into healthcare than just simply stomping our feet and saying we don't want anything to change. And I think we owed that to the process. So we've learned a lot along the way. And I can tell you that I've talked to experts that have been involved in healthcare for decades. I've talked with ex-government people, current government people, current people in the healthcare field. And what we're proposing, and I guess ultimately one of the options that MAHC had on the table, is something that would be considered to be a sustainable option going forward. People are overreacting in some cases to worst case scenarios, and we're not anywhere close to that area right now. We're trying to start a dialogue. We're trying to get MAHC to recognize that the community impact is what's vital here, that a decision can't be made in a bubble, and a one-site scenario creates a lot of problems for Muskoka going forward.